Hi,
Goodbye to.
this is
Okay.
Dr. Goh from Singapore. I want to thank Patrick Huang for asking me to give this lecture. How I use different lasers in my dermatology practice over the past 4 decades and what have I learned. So I will talk about the various lasers I have used over the last 4 decades, namely the ablative lasers, the vascular lasers, pigment lasers, something about hair removal lasers, vascular lasers again, skin surfacing lasers, skin tightening devices, body contouring devices. These are all the devices that came into being over the past 4 decades. It started off with the carbon dioxide lasers, which was introduced in early 1980s. And we acquired the first laser and got a lot of experience. It is still a very useful laser for us to use for ablating non-malignant lesions. Then there came along the pulse dye laser, which changed the way we treat the port wine stain. And after that, we have the pigment lasers, which was probably the most effective and commonly used lasers since it was introduced. So I'll start off with the pigment lasers that we have gone through. We have the Q-switch nanosecond lasers, which has been around for a long time. And recently we have the picosecond lasers that has been slightly better than the nanosecond lasers. And I'll talk about that in a short while. The IPL is also a useful device for pigment lesions. And basically, pigment removal lasers are the commonest and most cost-effective lasers required because we see a lot of pigmentary lesions in the Asian countries, and many of these conditions unfortunately recur, and patients have to come back for more treatment. So the question is that how do you decide on which pigment lasers to use and what to buy for your practice?
For the same. So this is the comment regarding this. But there is something also I think it's important to discuss, which is the fractional Q-switched lasers and the fractional picosecond lasers, because this is something new. I believe it might have a potential improvement of the outcome of the Q-switched and the picosecond lasers when we add on top the fractional handles. What do you think about that, Professor Go?
Well, we have been trying that. We are not getting the result of what has been reported, in fact, it is also used for skin rejuvenation, for acne scars and all that. And I have repeated that on a few patients, but I was not impressed by yet when some of my colleagues from Thailand and in fact, even some of them from Taiwan, they showed fantastic results, So I always ask them, is there something wrong with my protocol? Do I have to really smash up the skin before I see such a result? But I'm not getting them. So for your pigmentation melasma using fractional, theoretically it sounds very good, but I'm not seeing the results. So I'm waiting for more reports to come on board to convince me that I should try, or whether there's been any.
Has any of the colleagues tried the fractional Q-switched lasers or picosecond and can comment?
I do.
Can comment at the end. Yeah, I would like to hear.
Yeah, I use the picosecond. I've got the 1064, 532, 730, and the 755. So I use the 755 fractional. But when we look at the studies, even from Thailand, we were there at the WCD, and we had all these professors from Thailand. And you look at their parameters, some of them are very low parameters, some of them very, very high. Yeah. So there's no consensus on it. I am a very low guy, so I go very, very conservative. But once again, this is adjunctive therapy. It's with, secondary to your HQ, secondary to your T acid. I use that maybe in Australia because as we know with melasma, part of it is your, background photo damage or compromise of the basement membrane. Maybe if you use your fractional at a very low setting, maybe it helps with it with the LIOB. Maybe it reestablishes the type 4 collagen in your basement membrane. Maybe in a subgroup of melasma that can help. But I do use it. I do get good responses. I use it as adjunctive therapy, but not all cases respond. So I still have a failure rate of 20–30%.
Okay, let's move on to the second topic on the skin resurfacing for acne scars. Acne scars is a very common condition that we see in the Asian countries, and a lot of them are not happy with their treatment. Davin seems to have the best treatment outcome. I get a lot of his patients who comes to see me, after seeing him and saying that the results are very good. So maybe you want to share your experience with us. How do you normally approach a patient with acne scars? And the rest we can give you opinion.
Yeah. I think, as we mentioned before, the multimodality aspect is very good, very important. So you base it upon the scar signature itself, whether it be, your TCA cross, TCA paint, whether it be your subcision, your punch excision. So all of those modalities match up to the scar and treat the scar accordingly. When we talk about energy-based device, I agree with Patrick. Your gold standard is your CO2, fractional CO2. And I think it's very important to get a CO2 that actually has a good beam profile. It's something which delivers fractionation, but also randomization. So that way you decrease the thermal load rather than sequential. So there's a few good devices out there. I use the Pico in the context of acne scarring to remove the PIH which I cause from CO2. So I think, Prof, I think about 10, 15 years ago, we had breakfast and I asked you, how do you treat, Asian skin with CO2? And you told me, you said, you've got to tell them it's a trade. They got to trade their scars for temporary PIH. Otherwise, we can't remove the scar. So based upon that, I tell the patients, our skin, this is how we heal. We heal with a bigger pigment. I can go slow, but you'll need many treatments and may not be effective. I can go a little bit more aggressively. You will get post-inflammatory. You will get skin darkening. But if I got a Pico, I can use that Pico plus all your topicals to decrease or accelerate your PIH resolution. So in summary, I still like my ablative lasers over the non-ablative. I use them sensibly, but I combine that with Pico, not because I think Pico is great for scarring. Much like you, I think it's got minimal changes when it comes to texture, but I think it's a very useful device to reduce the amount of duration of PIH.
We agree on it.